Different types of depression. Depression, though one of the most common forms of mental illness in the world, is still vastly misunderstood. This is because it is difficult to differentiate between the intermittent episodes of sadness everyone experiences at some point of life, and the more serious feelings of sadness that arise in clinical depression. Researchers are not always sure what causes depressive disorders. But, genetics, abuse, medications, and major life events all have the potential to contribute to an episode of depression. The confusing part is, this illness also appears in many forms, and each with its own symptoms and different levels of severity. This makes it even more difficult for doctors to study and patients to deal with. Major depressive disorder is the most well-known kind of depression. The symptoms persist throughout the days, or most of the time. Usual symptoms are loss of interest in everything, heavy feelings of sadness, guilt, or worthlessness, and trouble concentrating. They cannot find enjoyment on things once they were enjoying in the past. If left untreated, major depression can spiral into thoughts of suicide, and even suicide attempts. The hallmark of major depression is its all-consuming quality. Even though one may only experience one bout of major depression in life, but that episode will affect the person at every time of the day, nearly every day. Some patients have described the feeling as being on autopilot, or as if there was something heavy on their chest that they could not move. Persistent depressive disorder is historically known as dysthymia. This form of depression occurs when depressive symptoms become chronic. The symptoms are very similar to major depressive disorder, but more persistent. Symptoms are less severe, but for a more extended period, sometimes for 2 years or longer. The exact cause of the disorder not identified, but it does sometimes run in families. Medications found very effective in major depressive patients may take longer time to work in persistent depressive patients or less effective. This depends on how deep-rooted the symptoms are. Bipolar disorder is frequently misdiagnosed as major depression. This illness consists of 2 distinct mood episodes. One is very similar to major depression, in which the patient feels sluggish, hazy, and unmotivated. And one described as manic, marked by high energy and feelings of euphoria. These moods can last for only a couple hours, or extend for months at a time. Every patient experiences mood swings differently. Patients first notice their symptoms when a depressive episode occurs. For this reason, a full history of their patient's behavior and moods through an interview is important. Otherwise misdiagnose the person as only depressive. Medications like lithium, a common mood stabilizer, can help patients control their moods. Psychotic depression is a unique form of depression that is accompanied by psychosis, a mental break with reality. Of those diagnosed with some form of depression, anywhere from 14 to 50% may experience psychotic symptoms, which include hallucinations, paranoia, or delusions. Unlike other mental illnesses that present with psychosis, like schizophrenia, psychotic depression specifically causes psychosis with depressive themes. For example, a person may exclusively hear voices telling them that they are useless or worthless, whereas someone with psychosis related to other illnesses might feel like they are being watched by a doppelganger or that someone they know has been replaced by an imposter. A combination of antidepressants and antipsychotic medications helps to control the illness. Talk therapy removes the feelings of shame or humiliation of the patient. Postpartum depression affects about 15% of women who give birth, saddling them with a severe form of depression that manifests within 4 weeks after delivery. This form of depression can cause classic symptoms, but tearfulness and trouble sleeping are especially common. Postpartum depression can occur in both mild and severe forms. In the most serious cases, women may feel incapable of taking care of their child, or have thoughts of harming the baby. In these cases, immediate professional help is essential. Seasonal affective disorder is more than feeling gloomy because the weather is nasty. Those with this form of depression usually notice their symptoms around the same time every year, usually beginning in the fall and continuing through the winter. Patients may feel irritable, sleepy, or generally low on energy during this time, in addition to common depressive symptoms. This depressive haze will then lift, as the season changes back to warmer, lighter weather. Seasonal affective disorder can manifest in anyone, but it is more common in those living in areas that have very few hours of sunlight during the winter. For this reason, light therapy is a popular treatment for the illness. It can help to regulate the body's biological clock and the release of serotonin, the happy hormone. Keep yourself busy if you want to avoid depression. Inactivity is the enemy. Thank you.